Hi, Gavin Stotz, student physical therapist at the University of St. Augustine, and today we will be doing a respiratory exam. First, we're going to start with a manual inspection of symmetry between the lungs during normal excursion. So first, we're going to place my thumbs at the top of the clavicles, and then I'm going to have my patient exhale. Good, and then I'm going to squeeze in a little bit, and then go ahead and inhale as deep as you can. Alright, and relax. So that was very symmetrical. Next we're going to go down to the xiphoid process. Okay, and we're going to do the same thing. Exhale. And squeeze in my thumbs together, and inhale. Looks good. Go ahead and relax. And then we're going to come around to the back. Okay. And we're going to come just underneath the scapula. Okay. Go ahead and exhale for me. Good. And then one big inhale. Nice. And relax. So the patient exhibited symmetrical breathing patterns for the left and right during the entire examination. So the next respiratory exam that we're going to do is we're going to take a tape measure to measure his excursion. So we have the tape measure parallel to the floor, and the first spot of measurement is underneath the axilla. So first we have his measurement right here at about 101 centimeters. Go ahead and take a breath out. Go ahead and exhale. Get down to about 100. Okay, go ahead and breathe in. Okay, and relax. So his excursion via the tape measure was measured at 2 centimeters. So our next measurement is at the xiphoid process, okay, and the tape measure is still parallel to the floor. His pre-measurement, go ahead and exhale, is 87. Okay, go ahead and inhale as deep as you can. All right, go ahead and relax. It's about 90.5, so we got about 3.5 centimeters. Okay, our last measurement is at the midpoint between the xiphoid process and the umbilicus. Okay, patient, go ahead and exhale for me. Okay, we're at about 81 centimeters. Okay, big inhale. And relax. So we got about 3.5 centimeters of measurement for the mid-abdominal junction. The next respiratory exam that we're going to perform is the pulmonary auscultation. So Dayton, if I can have your consent to listen to your lungs, it's going to be the stethoscope skin contact.
Yes.
Okay. So first we're going to palpate for the right middle lobe. And we're going to go to the fourth intercostal space. Okay, go ahead and take a deep breath for me. Exhale, good. Next we're going to move to the lingula on the left side. Come back down to the fourth intercostal space. Go ahead and take a deep breath. Okay. And then we're going to come back to the right middle lobe, down to the fifth intercostal space. Deep breath. Good. Okay, back to the lingula, going back down to the fifth intercostal space. Deep breath. Good. And all sounds sounded the same, and they sounded normal. So the next segment that we're going to find is the superior basal segment of the lower lobes. So we're going to find the scapula, the inferior angle, and that's at about T7. So we're going to go one space down to T8. Go ahead and take a deep breath in. Oh, good. I'm going to go to the other side. Deep breath in. And out. Good. Next segment is the posterior basal segment of the lower lobe. We're going to go down to T12, work our way up to T11, and then in that intercostal space, okay, deep breath in. Good. And deep breath in. Okay. And we're going to come back to the his left side, go down to the 12th intercostal space. Go ahead and breathe in. Good. Come back to this side. Go ahead and breathe in. Good. So, all sounds were normal and even. Respiratory exam that we are going to do is for transmitted sounds. Dayton, we're going to be performing a test called egophony. So I'm going to be placing the stethoscope at the superior basal segment of the left lower lobe. Okay? And what I'm going to have you do is when you feel my stethoscope on that segment, I want you to say the letter E and hold that sound. Okay? Okay. Okay. So that was a normal result. I did not hear a nasal sound, which would have produced a sound A. Alright, Dayton, now we're going to test for bronchophony. Okay, so when I place the stethoscope in the same spot on your back, I'm going to have you say the word 99 a few times, okay?
99, 99, 99.
Okay, so this was a normal result. It was muffled and indistinct. An abnormal sound would have been a loud and clear representation of that phrase. Alright, Dayton. The next exam we are doing is called whispered pectoriloquy. Okay, so I'm going to place my stethoscope on the same spot on your back. When you feel the stethoscope, please whisper 1, 2, 3 a few times for me, okay?
Okay. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Okay. And this was a normal result because his whispers were muffled and indistinct, whereas an abnormal sound would have been loud and distinct. Alright, Dayton, so the next exam that we're going to do is a mediate percussion. Okay, so I'm going to percuss the superior basal segment of the lower lobe. I'm going to take my finger. Okay, these sound normal and resonant, whereas a more dull sound is less air in the lungs, and a hyper-resonant sound would indicate that there is more air inside the lungs. For the next section of our respiratory exam, we are going to do postural draining with a couple of manual techniques, percussion and vibration. Okay, so we have our patient in a supine position with her right side elevated so that the right middle lobe can drain, and then her feet are elevated 12 inches. So, Brooke, today we're going to work on percussion first. So, I'm going to have you breathe in normally and exhale normally, and I'm going to provide a percussion on your right middle lobe. Mm-hmm. Okay? All right, so when you're ready, just go ahead and start breathing normally. Good. Okay, next we're going to do a vibration technique. So, upon inhalation, just breathe normally. And then when you exhale, I'm going to provide a vibration. Okay? Mm-hmm. All right, so I'll go ahead and breathe in. And exhale. And inhale. Exhale. Good. All right, Brooke, so now we're gonna check your right middle lobe to see if you are breathing better from our manual techniques, okay? All right, so we're gonna come down to the fourth intercostal space. Four. All right, deep breath for me. Good, one more. Good. Okay, now we're just going to move over here. All right, deep breath for me. One more. Good. And your airways sound much clearer after the manual techniques. So what we're going to be working on is active cycle breathing. Okay, so the first thing we're going to do is we're going to take one of our hands, place it on our stomach, and then the other on our chest. Okay, so I'm going to just demonstrate. You can just watch for now. So what we want to do is we want to make sure that our hand on the stomach is expanding more when we inhale than our hand on our chest. Okay, so it's going to look like this. Okay, so then the next one that we're going to do is our thoracic extension. We're just going to place our hands on the ribs, and then when we inhale, we're going to try and push our hands out. Okay, and then after that, when we exhale, we're going to let them sink back in. Okay, so it's going to look like this. And then the last technique that we are going to do is called the huffing technique. So we'll place both our hands on our stomach, and then when we inhale, we're going to focus on that diaphragmatic breath, and then when we exhale, we're going to try and perform a little bit of a huff. Okay, so it'll look something like this. We're going to inhale. Really try and feel your stomach contracting into your hands, okay? So could you do a brief rundown of what I demonstrated to you?
Sure. So first was diaphragmatic breathing, one hand on your chest, one over the abdomen. And our goal is to have the hand on your abdomen move more than the hand on the chest.
Perfect.
So inhaling, the hand moves out. Exhaling, hand moves in. And then next was the expansion exercises.
Mm-hmm.
So it's taking a deep breath in. We want to try to push our ribs out towards our hands, like this. And then feel them move in as we exhale. And the last one was the huffing mechanism. So while doing diaphragmatic breathing, we're going to breathe in. And on exhale, breathe out.
Good. Okay. So now that you know what we're doing, let's do just a quick run through so that you're not talking while doing your exercise.
Right.
Okay? All right. So let's start with diaphragmatic breathing. Okay. Go ahead and inhale. And exhale. Good. Good. One more time. Good. Now let's move on to the thoracic expansion. Excellent. One more time. Good. Now let's do the huffing technique. We'll just do this one once. Okay? So nice deep breath in. And then exhale. Huff. All right, not bad. Not bad. Okay, so for the last exam, in our respiratory exam, we're going to do the cough evaluation, okay? So, Brooke, can you show me how you would cough normally to get rid of any lung secretions? Okay, so in a cough evaluation, there are 4 phases. First, we have the irritation phase, then we have the inspiration, compression, and then the expulsion phase, okay? So, in a proper cough evaluation, what you're going to want to do is you're going to have the irritation, and then you're going to have the inspiration. So you're going to breathe in, kind of keeping your shoulders nice and relaxed and push them back. You're going to hold it there for the compression, and then you're going to expulse the secretion by rounding your shoulders forward and coughing to the side. Okay? So it's gonna look something like this. Okay? So can you do a demonstration for me?
Sure.
Good. Good.